that we had those discussions and the press release, one of the things that we discussed was that early in the pandemic, the Ohio Department of Health and the state made a decision to try to get information to the public, to the governor, to policymakers as quickly as possible. These decisions were made last March, and especially as it related to death data, we had decided to take the route that was fastest, but maybe not always as reliable. As I explained to you a few weeks ago, that process required some reconciliation, and that reconciliation was not being kept up with, and that's what caused our issue. And so we wanted to look at other ways that we could report the data. Our data is currently reported out of our state's disease surveillance system. We call that ODRS, the Ohio Disease Reporting System. And it's a disease surveillance system designed to track someone from the point of their illness through to its conclusion, whether that's full recovery, whether that unfortunately would result in a death, hospitalizations along the way, whatever those are. ODRS relies on information coming in from a number of sources, from hospitals, from local health districts, urgent cares. And that while that information is going to come in a little bit more real time, what it doesn't provide is as much certainty, and it's going to be dependent on several things like the reporting, the course, the person's illness, but it's really dependent on the update from the data providers. So in order to address this potential disconnect of trying to catch up what we call our vital statistics reporting system, or EDRS, which is the electronic death registration system, rather than using that to supplement ODRS, we were looking to maybe rely on, since that has so many fewer inaccuracies and is so much more reliable, relying on that as our sole and primary source for death data. It is, if you talk to professionals, the gold standard, so to speak. So with that, I'll turn it over to Dr. Vanderhoff to explain it a little bit better. And we'll work through the information and then take questions at the end. Dr. Vanderhoff?
Well, thank you. So let's start by looking at the graphic. The graphic that you're looking at, just give me a second here to, let's see here. Oh, hold on. All right. All right, so the graphic that you're looking at, now I can see it too, is illustrative. And let's begin by looking at the first piece in the puzzle, the part on the right, which is the Ohio Disease Reporting System, ODRS, that you heard Director McLeod reference. Now, as she said, the primary source of information that flows into ODRS comes from healthcare providers themselves. And that makes sense because what this system is in large strokes is a disease reporting system. And one of the diseases about which it gathers data is COVID. And it gathers that information from hospitals, local health districts, and urgent care centers who report this disease information and what they know about associated deaths as a part of that reporting. In many cases, this information is fairly real time. We may get information about a death within a matter of a couple of days related to that death, making it a much more real-time measure of mortality associated with COVID-19 in Ohio. And as the director said, early on in the pandemic, that was a priority. Now, let's look at the other side of the diagram, the part on the left, the electronic death registry system, EDRS, which relies upon information that comes from death certificates. Now, these death certificates are signed by an attending physician or other medical certifier and completed with additional data and information by the funeral home. This information then is sent through the EDRS system to the CDC's National Center for Health Statistics, NCHS, where it's verified and then coded regarding whether the death was the result of COVID-19. And that, of course, is based on the information they're receiving from the attending physician who completed the death certificate. Now, this is done to ensure that, for example, a person who was in a fatal car accident and was tested on arrival at the hospital as a routine measure and is tested positive for COVID-19 is not inaccurately counted as a death caused by COVID-19. So once verified, the death certificate is then coded, returned to the Ohio Department of Health's Bureau of Vital Statistics with a particular code, and that code is U071. And this process, as you can imagine, takes a little bit more time. It's highly accurate, but it takes a little more time. Generally is anywhere from 1 to 6 months, although we're told that the vast majority of information flows closer to that 4 to 6 week time period. Director, I'll turn it back to you.
Thank you, Bruce. So this brings us back to where we were a few weeks ago. And these two distinct steps had to be manually reconciled. As you saw on that graph, that point of reconciliation, actually, can you bring that graph back up? So the graph, on the right-hand side, that point of reconciliation where the spreadsheet came over to ODRS, this, you can see in the middle, it says spreadsheets of COVID deaths, and then it goes down and it says ODH team reconciles, and then there's a little kind of explosion there. That was where we had the issue. This is where we had a problem with the reconciliation because those files are very large. They come over with deaths, and they're looking for those that are coded because obviously EDRS and ODRS, despite the fact it takes the majority of our time, COVID-19 is not the only thing that they are currently working through and tracking and reporting. So the file that comes over is very large, and the reconciliation that was going on for purposes of COVID in an attempt to make real-time reporting was manual and obviously fraught with opportunities for issues. So as a result of the discovery about the lapse in reconciliation, we implemented some quality assurance. We implemented some quality assurance changes moving forward. It's caused us, though, at the same time to reevaluate our entire death reporting system. As you know, the department is committed to sharing as much as we can real-time information. At the same time, we don't want to do that and aren't going to do that at the sake of accuracy. The ODRS has been crucial to the pandemic response in Ohio, but it can't be overemphasized that the program is outdated. It was slated to begin being updated and changed at the time the pandemic hit. It still needs to be updated. Obviously, we couldn't continue forward with an update last March when, in fact, COVID hit and all attention needed to turn toward that and doing the best we can with the system we have. We are working with the legislature to get funding to ensure that we have funding in this next budget to start that process once again. I would love to be able to land the plane that what we say is we're building the plane as we fly it. And unfortunately, we weren't given all new parts to build it with. Unfortunately, we do not have time to stop the plane, to land it, get the new parts that we need, and then take off again. So we are determined to land this plane safely with the parts that we have. But in this particular instance, in order to get the most accurate and reliable information, we are looking to move toward a system where the reporting comes out from the EDRS system rather than ODRS, where there is less manual entry, less manual opportunities for issues, rely more on technology, and the human part will be the quality assurance and using those individuals to do more quality assurance of the technical process to ensure that the technical process is working as it should. But let me turn it back over to Dr. Vanderhoff, and he can talk a little bit about what we expect on the go forward with reporting.
Terrific. Thank you. So as you look at the diagram you're currently seeing on the screen, I think it provides a summary of the new process as I described it just a few minutes ago. And there's some key takeaways that I think are important. The first is we're confident that the data using this approach will be more accurate. Deaths will no longer be listed as probable because all deaths will be confirmed as COVID-19 deaths based on the appropriate ICD-10 coding. Secondly, while the data may lag, we believe that in most circumstances, we're talking about something in the neighborhood of 1 to 2 months. But understand that the rules around death certificates can allow, under certain circumstances, a death certificate to be completed in as much as 6 months. Anyone who has been through the process with a loved one of resolving their estate, though, knows how much pressure there is to get that death certificate completed and turned around in a timely way. And certainly as a physician with a lot of experience filling out death certificates, I know that both from the funeral home and from the family, there's usually strong pressure to get that death certificate completed in a very timely manner. Now, mortality data will no longer be updated, as the director referenced, on a daily basis. Rather, it'll be updated twice a week because that's how the data flows from EDRS. That's the interval during which the information is verified and coded at the National Center for Health Statistics. The day of the week we receive the mortality information may also vary. So for the foreseeable future, this information is not going to be updated on a specific day of the week. We'll update it as we receive the information from the National Center for Health Statistics. The remaining data, such as case data, will continue to be updated on its current schedule. So, that which goes on in ODRS will continue to go on in ODRS. And lastly, I'd note that there is going to be some fluctuation in deaths as we make the transition. We're moving from one system to another. The data will be accurate, but it could fluctuate just because there is a move from one system to the other. You'll notice the change, and we want you to be aware of what's happening. Director?
Thank you, Dr. Vanderhoff. We know many of you have been covering the pandemic for the past year. I also know many of you are among our most savvy COVID-19 dashboard users. Dr. Vanderhoff has covered the high-level information that you'll notice. You're also going to notice, however, some minor changes to a couple of the other dashboards. The ODRS system fed directly as it tracked the disease from onset to conclusion, whatever that conclusion was. And now that the information is coming from EDRS, you may notice some slight changes in a couple of the other dashboards. We wanted to offer this time, and there'll be some time later this afternoon, but we wanted to offer this time to also have our data team on. They're going to walk you through each dashboard so that you can take a look. But additionally, when this goes live, it should be changed and live at our 2 o'clock update today. Our data team will be hosting kind of some office hours at 2:30 that you can come back on, ask questions, make sure that you can still find everything that you're looking for. You should know that our data team, both here at ODH and at the state level, have worked very, very hard to try to make sure that, when we first talked about this, there was some discussion of, well, we won't be able to do this, or we won't be able to do that, to which we all responded, no, we want to continue to provide the same level of information. But because of this change, it may look a little different, or you may find it a little bit different. We just want to share all of that with you and make sure we can answer your questions to find everything you need. Luke Warren from our data team will do a quick overview. That's Luke, and then it's W-E-R-H-A-N. But he's going to do a quick overview of the dashboards now, And then again, please know that the office hours we have scheduled are at 2:30, and that will provide you more time to ask technical questions as you get on the site once it's changed and experience whatever questions that you may have at that time. Thank you. Go ahead, Luke.
Thank you. Well, good morning, everyone. As Director McLeod said, I'm going to show a quick overview of the dashboards and the data where you might notice some differences. So when you visit coronavirus.ohio.gov on our main page and on the key metrics page, the total deaths, confirmed deaths, and CDC expanded death definition of probable will become two boxes. So Ohio resident deaths and deaths in the state of Ohio. You'll notice this change throughout the dashboards, including on the children's dashboard. So next slide, please. Here's the difference. An Ohio resident death is someone from Ohio who died from COVID-19 anywhere. This could be someone who lives in Ohio and was hospitalized and unfortunately passed away in Indiana. A death in Ohio, on the other hand, is anyone who died from COVID-19 in the state of Ohio, regardless of where they live. An example of this would be someone who lives in Kentucky, but was hospitalized and then passed away in Ohio. Now, these numbers are different, but will both be included to help give a better picture of COVID-19 in Ohio. It is important to show the data by county or state of occurrence because that helps show the strain on the healthcare system in a given area in Ohio. In addition, it's helpful and important to show the data by county or state of residence because that helps to show the impact of COVID-19 in a given community. Now, to this point, our data has been based on residents. You may notice this means another box, probable deaths, will be removed. As Dr. Vanderhoff stated earlier, the mortality data we are using moving forward will only be for verified COVID-19 deaths, and therefore probable deaths will no longer appear on the dashboard. Next slide, please. Moving on to our overview dashboard, because the EDRS data isn't linked to an illness date, the presumed recovered number will still be based on ODRS data. Although it will not be used elsewhere on the dashboard, because it is linked to case data, the ODRS death data will prevent the state from inadvertently listing someone who lost their life to COVID-19 on the presumed recovered metric. Next slide, please. The summary data CSV spreadsheet that you download will still show cases, hospitalizations, and deaths. However, it will no longer link death data with case or hospitalization data, essentially becoming their own rows of data that are not tied to the case and hospitalization data or dates. Next slide, please. The current trends 21-day chart will also look a little different. First, the death data on this chart will now only be updated twice weekly as we receive that information. This means that most days, the deaths reported in the last 24 hours would be 0, and the 21-day trends graph will show spikes for the last 24 hours, will show spikes for the days in which data is reported alongside the average 21-day figure. Mortality data on this chart will be based on county of residence. Next slide, please.